My task for this afternoon is to discuss burn injury, priority nursing intervention, and promotion of patient safety. Nurses, we have to classify burn injury according to causes, and one classification of your injury according to causes is what we call your thermal burn injury. When I say thermal burn injury, this is being caused by hot liquids or substances. Another classification according to causes of your burn injury is what we call your electrical burn injury. Electrical burn injury is one common cause of cardiac dysrhythmias or cardiac arrest. Another type of your burn injury is being caused by strong acids, so you call that one as chemical burn injury. The last one, classification, is what we call your radiation burn injury. And one best example of radiation burn injury is exposure to the UV rays of the sun. So that is the classification of your burn injury according to causes. Always remember also nurses that we can classify burn injury according to the layers of the skin affected. If we are to talk about classification according to the layers of the skin affected, then we can consider, of course, first degree burn. When I say first degree burn, the other term for your first degree burn is what we call your superficial burn injury. In this type of burn injury, the one being affected is the epidermal layer, which is the outermost layer of the skin. The manifestation of the patient with first degree burn is that there is positive pain because of the stimulation of the nociceptor, and at the same time remember that the color of the skin is red in color. The second classification, according to the layers of the skin being affected, is what we call the second degree burn. Second degree burn injury is what we call your partial thickness burn. Of course, the one being affected here is the epidermal layer plus the dermis, and the manifestation of the patient this time, you can expect presence of blisters, and again, there is positive pain for the patient because of the stimulation of the nociceptor. After the second degree burn, you have third degree burn injury. At this time, the one being affected for your third degree burn is the epidermis layer, the dermis, and the subcutaneous tissue. The color of the skin this time is fairly white in color. And take note, nurses, that there is now negative pain for the patient. The rationale behind negative pain for the patient is that there is no damage of your nociceptor. So we can expect pain only for the first, second degree burn injury. But for the third one, because of the damage of your nociceptor, there is negative pain for your patient. The last one is what you call your full thickness burn injury, and that is of course the fourth degree burn. The color of the skin this time is black, or you call this one as charred in color. This time again, there is negative pain for a patient because of the damaged nociceptor. So we are done with the classification of your burn injury, and that's according to causes, and that's according to the layers of the skin affected. Okay, at this point, I would like to highlight the phases of your burn injury. I am a type of educator, and I would always like my student to understand the topic. That's why I may going to use some representation to better understand the topic, because if you know the disorder, if you know your pathophysiology, then you can safely give appropriate nursing intervention to your patient. Am I right? Okay, so the phases of your burn injury is divided into three phases. The first phase of your burn injury is expected for the first 48 hours. You can call the first phase of your burn injury as the oliguric phase. You can call this one also as your burn shock phase, or maybe you can call this one as the emergent phase of your burn injury. Why is that so? Maybe because the explanation is that I'm going to use some representation for this. If this is the blood vessel, remember nurses, after burn injury, that is a type of tissue injury, there is always release of your vasoactive substance. If there is release of your vasoactive substance, then you can always expect, of course, that there is increase of your capillary permeability. If there is increase in capillary permeability, then there is shifting of fluid from the vascular to the interstitial space. If this would going to happen, then you can expect that there is decrease in your blood volume, giving rise to your specific manifestation. One of your manifestations that you can expect here is that there is always scanty urine or oliguria, or decrease of your urine output. The reason behind decrease of your urine output is that if there is decreased blood volume, you can always expect decrease of your glomerular filtration rate. If there is decrease of your GFR, then expect decrease of your urine output. I would like to highlight that if there is decrease in blood volume, you can expect also hemoconcentration here. So the blood is concentrated as well. You call that one as your hemoconcentration due to the decrease of your blood volume. And because of cell injury or cell damage, there is liberation of potassium from the cell, and the potassium will going to the vascular space, leading to an increase of your potassium level. You call that one as your hyperkalemia. So this is the third manifestation during the first phase of your burn injury. Another manifestation is that there is fluid shifting, so the sodium is being trapped in the edema fluid. Once there is decreased sodium in the vascular space, the sodium is being used to form sodium bicarbonate. So there is acid-base imbalance that you can expect during the first phase of your burn injury. So that acid-base imbalance, because of the decrease of your sodium, thereby decreasing sodium bicarbonate, then you can expect, of course, metabolic acidosis during the first phase of your burn injury. Okay, so we are done with the first phase, and always remember, for the first phase, there is always dehydration. That's why your priority nursing intervention, one of your priority nursing intervention later, is of course fluid replacement. That's why I'm highlighting this time that you have decrease of your urine output. The second phase of your burn injury is expected for the second 48 hours. The second phase is what we call the fluid remobilization phase. If I'm going to represent the fluid remobilization phase, again, if this is the blood vessel, the fluid from the interstitial space will now going to shift to the vascular space, leading to your increase in blood volume. Again, if there is increase in blood volume, there is increase in your glomerular filtration rate, leading to an increase of your urine output. That's why the second phase of your burn injury is also being called as the diuretic phase. So there is difference between the first phase and the second phase. The first phase is what we call the oliguric, and the second phase is what we call the diuretic phase of your burn injury. The last phase of your burn injury, or the third phase, is the recovery phase. And this is expected 5th day onwards. So nurses, take note that we are done with the classification of your burn injury. At the same time, we have talked about and discussed the phases of your burn injury. The first phase, the second phase, and the third phase of your burn injury. Okay, at this point, I would like to highlight our nursing management. Of course, as nurses, we have to utilize the nursing process. Okay, so our priority here is, of course, to stop the burning process. Okay, how do we stop the burning process? You can instruct the client to drop and roll, or roll on the ground, or maybe you can throw a blanket to your patient to stop the burning process. And in case of fire, we can make use, of course, of the mnemonic rays. Okay, you can still recall what's the meaning of rays. If you can still remember, as a review, rays stands for R is rescue of your patient. Remember that our priority is the patient safety. So R stands for rescue or remove your client from the source of, from the injury. Letter A stands for activate alarm. And C is we have to confine the fire. And then the last one is, of course, we have to extinguish the fire with the use of your fire extinguisher. If you can still remember how to use your fire extinguisher, we have mnemonics that we have to observe as well. Remember, we have your pass. You have to pull, you have to aim, and then you have to squeeze and sweep from side to side. So that is how to use your fire extinguisher in case of fire in the hospital. So we are done with your priority nursing intervention. Remember always that we have to prioritize the safety of your client. Okay, so the third one is the collaborative nursing management. When I say collaborative nursing management, this is one of our interdependent nursing management. So your priority for your management here, for your collaborative management, is that you have to check for the patency of the airway. So airway is still your priority. You have to take note, nurses, the respiratory rate of your patient. You have to observe burned nasal hair, and you have also to observe any discharges or color of your the secretions from the airway is because there is potential um, inhalation injury, and you can also expect that there is discoloration of your sputum. So you have to take note of that. Okay, aside from prioritization of your airway, we also have to take note that we need, of course, to maintain fluid and electrolyte balance. Why do we have to maintain fluid and electrolyte balance? Remember, I did mention about the first phase of your burn injury, that is the dehydration phase or the oliguric phase. So we have to replace, of course, fluid and electrolyte to your patient because there is possible dehydration to your patient. So we can make use of your colloids. Maybe one of your colloids that can be ordered by your doctor is the use of your plain NSS, and as an isotonic agent. You can make use also of your plain LR as part of your management, and they are crystalloids. You can also make use of your colloids as plasma expanders. Example of your plasma expanders, if you can still remember, we can make use of your albumin, you can have your dextran, or maybe you can have your pentastarch for that. So remember, you have your colloids and you have your crystalloids. Okay, since I'm talking about fluid replacement, we have to take note, nurses, that we have to compute the amount of fluid that should be given to your patient. So how do you compute the amount of fluid that should be given to your patient? We have to observe, of course, the Baxter-Parkland formula, or what we call the consensus formula. If you can still remember, the formula is 4 ml times kilogram body weight. Remember, the weight of your patient should be in kilogram times the TBSA. TBSA stands for the total body surface area affected. So at this point for your TBSA, you can make use of the rule of nines to approximate the burn or the area of the body being affected. So this is the formula again, 4 ml times kilogram body weight times the TBSA. Okay, so we can make use of the rule of nines. Example, if the patient is, the patient weight is 50 kilograms, so we can make use of 4 ml, and that's constant, and that should be multiplied by 50 because the 50 weighs 50 kilogram. And if the burn injury or the patient sustained burn injury over the entire anterior trunk, if I say entire anterior trunk, I'm talking about the chest, and I'm talking about the abdomen. So the chest is 9%, and the abdomen is also another 9%. So a total of 18%, right? So 4 times 50 times 18, that will give us 3,600 ml, and this will be your total fluid replacement. But always remember, the 3,600 ml should not be given for the first 8 hours. This is good for 24 hours. You have to distribute this one, alright? Okay, so how to distribute the 3,600 ml for the first 8 hours, nurses, always remember, you have to give the 50% of 3,600 ml. So 50% of 3,600 ml, so we can give, of course, 1,800 ml. And that is for the first 8 hours. Okay, for the second 8 hours, you have to give here the next, 25% of your 3,600. And that will give us approximately 900 ml for the second 8 hours. The last third 8 hours, we have to give the last 25%. Alright? So the last 25% again is another 900 ml. So if you can notice, the 3,600 ml is good for 24 hours. So 8, first 8 hours, second 8 hours, and then third 8 hours, and that is good for 24 hours. So at this point, I know you know your formula, you know how to replace your fluid, and remember that will be one of your priority because of the oliguric phase or the burn shock stage of your in our patient. So we are done with your computation, and I hope you can still remember this one when you practice in the clinical area. Okay, the next priority here, aside from checking of the patency of the airway, and fluid and electrolyte status, we have also to prevent pain to your patient. Okay, management of pain, you can make use of your strong analgesic agent, and that strong analgesic agent, you can still remember, you can make use of your narcotic analgesic. Remember narcotic analgesic, one is morphine, but take note, at the bedside, you have to prepare at the bedside, of course, your narcotic antagonist, and that is, of course, your Narcan, because it can depress or decrease the central nervous system activity, thereby decreasing also your respiratory rate. So below 12, you have to withhold the drug, and you have to prepare at the bedside your antagonist, and that is, of course, your Narcan or your naloxone hydrochloride. Okay? So remember, one of our responsibilities is to decrease pain and to relieve pain for your patient. Okay. Another responsibility here after pain management is that we have to control infection as well. Okay. How to control infection? Any type of infection or after burn injury, the patient should be given passive and active immunity. If you are to give your patient tetanus immune globulin, globulins is containing antibodies. So this time, it will give your patient passive type of immunity. Okay, we are also to give active type of immunity to your patient. By giving tetanus toxoid or toxins to your patient, just like your Tetobox, that is the type of your active immunity. Why active is because that's toxoid. Once toxoid is in the blood, it will stimulate production of your antibodies. That's why you have the passive and you have your active immunity. Alright? Okay. So aside from giving of your tetanus immune globulin and your tetanus toxoid, we can also make use of your topical antimicrobial agents. One of your best topical and the oldest one to control infection is your silver nitrate. Okay, you have to take note that silver nitrate is one of the oldest medication, topical antimicrobial agent being used for the patient after burn injury. But for your silver nitrate, you cannot just apply this directly to the skin of the patient because it can lead to staining of the skin. So how are you going to apply? You can make use of a thin layer of your gauze. After applying thin layer of your gauze, then apply your medication. That way, we can prevent staining of the skin. Alright? Okay. After silver nitrate, we can also make use of your sulfamylon or your mapimid acetate. Sulfamylon this time is very interesting, and this is one of the most common antimicrobial agent being used by the doctors right now. It's because this can penetrate the scar. Remember, if I say a scar, that is the necrotic tissue without the blood supply. So if you are to make use of the sulfamylon, even you have the necrotic tissue above, then it can still penetrate the scar or the deeper layer of the skin. So this one is one best antibiotics for your patient because it can penetrate the scar completely. Alright, so you have your sulfamylon and your silver nitrate. So that is to control the infection for your patient. Okay, aside from management of your infection, of course, you have to remember that we have also to prioritize, and you don't have to forget to maintain the nutrition of your patient. Alright? Okay, so how to adequately give nutrition to your patient? We have to give, of course, high in carbohydrates. You should have high in calories, something that can promote tissue healing. So vitamin A, vitamin C, vitamin E, and zinc should be provided to your patient, okay, in order to promote tissue healing. So that will be our priority nursing management, and I hope you have learned something from the discussion. And always remember, promotion of safety and utilization of nursing process is very important in any nursing discussion. Thank you very much and have a good day.